Hello Schneider Clinic followers, Dr. Schneider and Dr. Matt Bennett here today. We want to go over some of the unique things that exist in treating of sinus problems and allergy problems. You've got old school here with me, you've got young school with Dr. Bennett here. So this afternoon we're just going to spend a few minutes and discuss the anatomy of your head and your sinuses, what can cause allergy and sinus problems. Some of these things can be around so long that they lead to sleep apnea, they can lead to snoring, so they can be some serious conditions outside of just being annoying and everything else. But we've got some good answers for a lot of our patients, and for those of you out there who either just want more information about what's happening in your head and sinuses, or if you're seeking to get an opinion from us as to whether the things that we do from a treatment aspect could help you. We'll also leave you with some tips, things you can do just at home to help relieve some of those sinus and allergy issues. So we might as well go ahead and get started here today. Up on a screen behind us here, we're going to show you an animation of the skull, which if you look here, you'll see the different colors of the bones of the skull. Most people that I run into here in my clinic, and Dr. Bennett might also be able to add into that, think that their head is one big solid bone. They don't realize that that 12-pound ball sitting up on top of their head is actually a bunch of bones put together, connected at the joints, the plates, the cranial plates connected to the joints, called cranial sutures, which is just another name for the joint in the head. And they also think that those joints maybe are fused, and they're not. They actually move just a little bit because there's a movement in that skull called the cranial respiratory function, which actually helps to keep those plates movable. You can see as we come to the front all of the different names of these skull bones that are around here, your eye sockets, the arches around your lower face area. Now we're turning around to the back side of that, the occiput bone, the two parietal bones. Now they're going to flip that over so we can see the underneath side where the hole is in the purple there, where your brain stem comes out, the jaw, and how that all rests and connects with the sphenoid bone of the skull. On top you'll see your frontal bone and the two parietal bones up there coming to the other side here. Now we're going to just explode that a little bit for you so that you can see those sutures. They look kind of jagged there, those joints, but they fit together so that your skull does seem as though it's one solid piece. A lot of those bones will house some of the sinus cavities, as they're called, and there's two above your forehead, one on the right, one on the left, and then you've got two in the back, kind of behind the eyes, called the ethmoids, and then you've got the maxillaries, which are kind of up under your cheeks there. And as you see that spin around, you kind of see all of those little tiny bones, which if you've had any head trauma, or if you've had any damage even as a baby coming out of the womb, sometimes those misshapen heads, if they're not back together, you'll get some odd shaped bones and bumps in your head. So anyway, the skull's coming back together for us here, and that's a pretty good animation to give you an idea of how intricate the whole thing is in your head there.
Alright, so now we're going to take a look. If we cut your head in half and look at from the inside of your nasal cavity, so you got your superior concha, middle concha, and inferior concha. All these are responsible for bringing air through and in through all the meatuses then underneath those turbinate bones.
So you're saying that when somebody breathes in through their nose, they've got these folds in there that are wet membranes, and as that air comes through, it moistens it, and if those are all swollen, it doesn't get through.
Right, exactly.
Ah, I see.
Yep. So there's a zoomed in picture of underneath, so that's actually where the air is traveling in between those turbinate bones. Alright, so yeah, with what you said about your mucus getting all clogged up, your smell is going to be affected, even taste could be affected through that with your nasal.
So that upper area, that bulb they're talking about, that's actually a big nerve center sitting at the bottom of your eyes and up in your nose. That's cool.
Yep. And then you got your frontal sinuses and other sinuses that drain then into these cavities, and if they're all blocked up, you're not going to get good drainage. They'll go into your throat.
Wow.
cause
So
you that throat problem.
clearing my throat. So there's all these holes also that drain out of those holes in the bone, right into your sinus. Very intricate. I'm telling you, it's amazing what goes into smell and breathing and taste. And so any of these symptoms that, you know, might be associated with, you know, the allergies or the sinus problems or the breathing problems or the snoring or the tasting could all be connected to that. Well, it's pretty interesting.
So what can we do to fix this, Dr. Mark?
Well, if those areas are blocked up, which you can see with those holes in there, if those turbinates, as they're called, or those folds that are in there, of course on your right side and your left side, if those get swollen up, irritated, those holes will get blocked, and those will just not drain out of the frontal sinus and maxillary sinus, ethmoid sinuses. That pressure just builds behind there. You can get pain in your eyes. Sometimes you'll even get headaches from that. You'll get just that pressure in the head that just, you know, you really want to just, you know, sometimes people say, I just want to explode my head and get this pressure out of there. So very intricate. That's the anatomy. That's what goes on in there. That's why things can get blocked up. And of course, on a medical standpoint, you know, what do they like to do to try to fix that? Well, drugs. They say, well, let's take an antihistamine. Let's do something to try to decrease the swelling of these turbinates that are in there. All those nerves you can see that come out can pinch those nerves in there when it's swollen. But the antihistamines, those can cause, if you use it too much, those can cause not only absorption of the bad things that are in those antihistamines and those drugs up into the blood supply into the head, but also chronic use can cause real drying of these turbinates, those folds that are up there, and cause cracking, and then more allergies get across those barriers and cause more and more problems. So it just gets to be this vicious cycle that goes on and on and on. What we want to try to do is not say, hey, let's cover it up with a drug. We don't want to get to the point that there's so much scar tissue up in those turbinates that are up in there that you know, you're forced to say, oh man, I have to do surgery on this, where they kind of take a roto-rooter and grind all that out up in your nose. Not pretty. Had so many patients that have done that one time, 2 times, 3 times, and they're really not getting any better, and they just wish they'd have never done it. So we have a very unique approach to what we do as far as working with the cranial bones, which we saw earlier in the video, doing some adjusting with that, whether it's with our hands or whether it's with our gentle instrument that we'll use with the activator. We also have a very unique approach that we will use a balloon to actually go up into those turbinates and very gently open those turbinates and try to get the swelling out of there. Open up those holes that are up in that head, that in the sinuses, that they can drain that. Then the body can start to heal. Basically, we want to really just create an environment in working with these that the body can do what it was meant to do, can function as it was meant to function. So very interesting, a lot of success with the allergies and the sinus problems, sometimes the sleep apnea. So these are things that if you have more questions, you can certainly submit them to us online. You can go to schneiderclinic.com, or you can put it in the comments section with that. Certainly follow our YouTube video channel as we get going with our first podcast, YouTube cast, Facebook cast. We're not sure what we're going to call it, but it's...
we'll figure it out.
Yeah, we'll figure it out. Hope you enjoyed it. Hope you learned something today. Certainly you can call us at 574-293-7000. Set up a time. We'll even do a free consultation with you to see if these are your problems and see if our unique approach to treating this, which, by the way, we've been using since my grandfather back in the early 50s had his own clinic, and my father and now. So it's been 75 years that these have shown very good results. So thanks for watching, and have yourself a great day. Signing off.